Hey guys, I'm going to be going over everything that you missed in the meeting that we had yesterday. So there'll be a video that you need to watch on PPE, and it's about 11 minutes, and it's on our YouTube channel. And so you'll watch that, and then you'll watch this video of everything you missed. So let's talk about transmission-based precautions first. The one important thing you need to take away from this section of the in-service is that when we have a precaution sign on the door, whether it's a pink precaution for droplet contact, green for droplet, brown for enteric, or orange for contact precaution, you have to follow what's on the sign. Whatever PPE it says that you need to wear, that's what you need to wear. In addition, we also are in the middle of COVID, so we also have to wear either a face mask or we have to, like a procedure mask, or we have to wear an N95 or eyewear for in an outbreak. So that's a given. But you don't get to make the decision about whether you feel it's necessary to wear PPE in the room or not. That's not a decision you get to make. We all follow the instructions that are on the isolation sign. That's a care plan of how we can go in and take care of that patient safely for us and for the resident and for all the residents we're going to see throughout the day and our coworkers. So you have to follow those signs. You do not enter one of these rooms without having all the PPE on that is required. Okay. Any questions about that? You can give me a call. You can talk to your RCM, the floor nurse, the DNS, and we can answer your questions. So we have several different what we call pink precautions, which is the contact droplet precautions, all related to COVID. So we have, you'll see the two pink signs on the door, and then below that you'll see a sign. This is like a blank paper, and it'll have a sticker on it. Sometimes it'll be a quarantine sticker. Those are for residents who have been exposed. Maybe to a positive employee, maybe they went to an activity where they have been exposed, maybe family came to visit and they had been exposed to a positive person, and so we'll have them in a quarantine to monitor them. And then we have residents who, and that's a 10-day, I'll talk about that in a minute. Then we have residents who are admitted who are unvaccinated or are not up to date on their vaccination, and they will also be a quarantine. So that quarantine lasts 7 to 10 days. It depends on if they come back positive or not. So we test all our new admissions and readmissions within an hour of coming to our building, and then we'll test them again in 7 days with a rapid test. And if that test is negative, then I'll take them off on day 8. If it's positive, they'll be on for the full 10 days of quarantine. And you'll know that. I'll send out an email. We have a transmission-based precaution grid that's on the nursing folder that you can look at. You can also look at the IP notes in the residence chart. And then we have a sticker that would be isolation. Maybe they're showing signs and symptoms, so we're putting them under isolation to monitor them and test them. And then there may be, like if they came back positive, then we would start making the arrangements to get them to our COVID unit as fast as we could. And then we have another sticker that says BiPAP, sorry, I'm just reviewing my notes, BiPAP, CPAP, or neb treatments, that kind of sticker. And so for those residents, you would only use your PPE when they're actively using their CPAP or actively receiving a neb treatment, and for 2 hours after the completion of one of those therapies. So, and then there's another sign that goes up in the door. It's like a dry erase sign, and it would be like the time they started their CPAP or the time they started their neb treatment, and when it would be safe to go in there not wearing PPE. So while they're receiving those therapies, you have to wear full PPE, N95 mask, eyewear, gown, gloves. And then once that's all done and it's been the 2 hours, then you can just wear whatever mask is required for whatever times we're in. Now, sometimes you'll have a patient that's on getting CPAP, and then they may have C. diff. So they'll be on a pink precaution and they'll be on a brown enteric precaution. And so you always have to follow the most strictest of the PPE guidelines for that room. So whatever the stricter of the precautions are for that. Then we have what we call the orange contact precautions. So that's for MRSA, VRE, CRE, herpes, shingles, anything like that. And pre-COVID, it would just be a gown and gloves. And now it's gown, gloves, and some type of mask, possibly eyewear. And then you have the enteric precautions, which is C. diff, norovirus, and unexplained vomiting and diarrhea. And those are highly contagious, easy to transfer to another, transmit to another resident or yourself if you're not following those precautions. So remember, with those rooms, you don't use alcohol-based hand sanitizer, use soap and water only for those residents when you're going in and out of their rooms or in between glove changes. And then, so we do have a green precaution, which is droplet precaution. And we haven't seen that one. We haven't used that one in like 2.5 years because that one was for like RSV or flu or metapneumovirus, and we haven't seen those. So we haven't used that for a while. So I guess that's one good thing about wearing a mask because we haven't seen those issues. And then a new one that we're starting, and it's only for long-term care facilities, and it's in the enhanced barrier precaution. And it is also an orange sign, but it looks like this. And you're going to start seeing that on specific residents. Nobody will come in on this precaution. They'll come in on contact, and then I can transfer them over to this precaution. But I want to evaluate their chart and look through their hospitalization and see if they qualify and would benefit for this type of precaution. You still need to wear, like when you're wearing your gloves and your gown for any high, excuse me, any high contact resident care activities like dressing, bathing, showering, transferring, changing linens, providing hygiene, changing brief, assist with toileting, and then any device care like central line, urinary cath, tube feeding, trach, and then wound care. Any open skin opening requiring a dressing, you would wear the gown and the gloves. But this allows residents, say, who have had ESBL forever, or a pan-sensitive organism, some types of CRE, would benefit from this type of precaution because we're a long-term care skilled facility. We can't expect people to stay in their room for a year like a hospital would have them in contact precautions here in our area for a year every time they go into the hospital. Well, we can't really do that, but we need to protect everybody as well. So I think these enhanced barrier precautions are a great idea. It'll allow us to keep the residents safe, keep us safe, but also allow specific residents to be able to come out of their room. But there's a lot of details that have to be worked out before we can put somebody on this precaution. So but you're going to see this pretty soon because I have 2 residents in mind to put this on, and we have specific care plans for that as well. So be looking for that. I'll send out an email when we officially roll that out. So that's really it on transmission-based precautions. We have signs up on the isolation carts that kind of review the donning and doffing, the order you don, the order you doff. We have those available. So, and you can always, if you're not really used to putting all that on, maybe you're a new CNA or a new nurse and you haven't really practiced that a lot, have a seasoned employee watch you don and doff. That's okay. Sometimes I have shoulder problems, so I have to have somebody help me tie my gown around the neck at the bottom, so or the waist area. So get help. We all need to work as a team to make sure we're safe. So the next thing I want to talk about is Okay, the next thing I wanted to talk about was abuse and neglect reporting. Everybody is a mandatory reporter. Um, and you don't have to be 100% certain that something's going on. It could be a feeling you have, it could be something that you heard, it could be something you observed yourself, maybe something a family member told you, maybe something the resident told you, maybe something another employee told you, and you are a mandatory reporter. So you need to turn that in to the charge nurse, your floor nurse. If you feel like that's not being handled in a timely manner, you need to escalate it up the chain. That's your responsibility. So I always say, once you tell one person, you just can't wash your hands of it and you're done. You really have to make sure that something is happening, that steps are being taken. So bump that up the chain. If something happened over the weekend or on knock shift and there's no admin here, no managers here, no DNS, RCM, RCC, I'm not here maybe, then there's phone numbers at every nurse's station where you can call the DNS, call the administrator, call our CEO and alert them, especially if it's agency staff and maybe they don't know the phone numbers. You as a CNA can obviously call and say, hey, something's happened and I need you to report it. Don't ever email that. This is really time sensitive, super critical. So you wouldn't email those things. You have to actually talk to a person. So you keep calling until you get somebody on the phone and talk to them about what you've witnessed or what you've heard. So, and it could be, it could be something maybe you're not certain about. You still should report it and let somebody who's, trained in doing these investigations take over and determine whether that is abuse or not abuse, and notifying APS and all those things. So you have the easy part really of just telling somebody. That's the important thing. If you witness something or you heard something, somebody came and told you something, and you don't want to get involved and you don't say anything, and that person continues to abuse or verbally abuse or do something, or maybe it's the family who's doing something and you don't want to get involved and you don't say anything, you're just as culpable. That is also, a violation of it's abuse. That's what it is. You're allowing that to continue because you haven't said anything. So you need to make sure that you always say something. You can't worry about somebody getting in trouble or somebody losing their job, or that's your best friend. You've worked with this person forever. You can't imagine it happening. That's not your decision to make. You have to report it, and then there'll be a full detailed investigation. But that's your job. Our obligation is to our resident, and it's not to each other, if that makes sense. We have an obligation to keep them safe and healthy, in an environment that's safe and healthy. That's our job. You also have a policy and procedure in the packet that you're going to begin. So please read that, and it gives you all the details of what you need to do. And then there's also an in-service that I've done, that I've written up, and it talks about, which we did this last month, it talks about all the different types of elder abuse and what those look like, and what those sound like, and how to report. It talks about that a little bit more in detail as well. And then I think, which was not really part of this in-service, but I would want to say that self-care, take care of yourself. Take those breaks, take those meal times, and take self-care is really important when you're taking care of anybody, when you're a caregiver, even of somebody at home. Those help decrease those risks of maybe saying something inappropriately or doing something that's inappropriate. And so self-care is really important. So Okay, and then the last thing I want to talk about is medication errors. Just a couple of little things. I think it was in February we did a whole in-service on the rights and MedPass and how to prevent med errors. There was a couple people who went to a class on that Consonas had that was great. And then we will, in the near future, have Consonas come out and be giving another class. And so in the meantime, I just want to touch up base on a couple of things. We do not leave meds at the bedside. Never. We have, I think, 2 people up here right now that are allowed a few meds at bedside, but that has been evaluated, documented, care planned, approved by the physician and or their provider, and they're able to do those. But that's only 2, and it's only for a few specific medications. We do not leave any meds at the bedside. So say I'm a patient and I'm alert and I'm oriented and I'm able to even maybe ambulate, but I have wound care needs. You know, maybe I'm okay to take my medicines, but if there's not been an evaluation of that and it's not been documented and approved by the physician and care planned, you cannot leave my meds at the bedside. What if you left them there and I forgot to take them, and maybe somebody wandered into the room and accidentally took them, or they had a visitor that took them, or they forgot to take them and they wind up still on their meal tray and now in the kitchen? You have to make sure your resident takes their pills before you leave the room. If they say, oh, I want to put something on my stomach first, or, oh, I'm going to take those in 30 minutes, just say, okay, no problem. I'm going to take them back to the cart, and when you're ready to take them, just put your call line on and I'll come in and give them to you. But do not ever leave them at the bedside. It's really dangerous. And some people who you think are capable maybe of doing their med pass, when you go in and you evaluate them, you really realize they're really not capable of taking them, making sure they take them correctly. So that's one thing. The other is you've got to clean that pill cutter. So I was going to bring a thing of alcohol, and I think I forgot. But so hang on one second. Ricky and a couple other nurses brought this up yesterday in our meeting that, you want to clean it off with an alcohol pad, but that thing is really sharp. And you don't want to cut yourself either, but you need to make sure it's clean between every time you use it so that you don't transfer medication to one patient. Maybe you cut some penicillin derivative medication and the next person that you give medication to and use the pill cutter is allergic to penicillin. And you just transferred even the littlest bit of medication onto that other resident. And that could be, deadly to some residents. And it definitely is a medication error. So make sure you're cleaning that pill cutter. So I would clean the pill cutter when I would come on and I got my cart all clean and my cart all disinfected and I got everything set up for my first med pass. That's when I would clean the pill cutter, and you want to make sure it dries completely in between using it. So I think this is how Ricky said that she does it, because just doing it like putting your alcohol pad with one pad could risk cutting yourself. So she uses a second pad, puts it on top, and then just kind of folds it and puts it over the blade and just kind of squeezes it and pulls up, and that cleans it off. And then you're not going back and forth and potentially possibly cut it. I shouldn't probably do it. There we go, with your finger. So just put it down over it and pinch it up. And maybe you have to do it a couple times, and then you're good to go. Also, don't take any shortcuts when you're passing your meds. When you're in the middle of a med pass, that's the time you really don't want anybody kind of stopping and asking you questions a lot, because every time it interrupts you, kind of have to start over from the beginning to make sure you haven't missed any steps, to make sure you're giving the right medication to the right patient. So a couple things you can do is when you do your morning huddles with your CNA team, let them know that, hey, when I'm doing my med pass, anything that's not urgent and you feel like I need to lay eyes on right at that moment, or a patient needs medication right at that moment, I want you to put everything on a sticky note with their name and the room number and what they need, and put it to the side of my cart right here, and I will check them right when I'm done with my med pass. Or I know some facilities, I know some hospitals have like colored mats that they stand on to let people know that they're in the middle of their med pass. However you do it, whether it's probably just easy just having a conversation with them and saying put everything on a sticky note, then that way you're not interrupted constantly, and that's when you have your greatest med errors, when you're constantly being interrupted and distracted. So you want to stay off your phone unless you're looking up a medication in the drug book on your phone or something like that. But stay off your phone, no music, try no distractions, and just focus on your med pass and on the medication for that specific resident. Checking the date of birth is a gold standard. Not all of our residents on the second floor have armbands because they live here and they don't like wearing those. This is their home. They don't want to wear an armband. That's fine. But we have pictures on Point Click Care so you can look at the resident. If you happen to see a picture of a resident and you're like, oh, wow, that doesn't look like anything like this patient now. Maybe they've been here for 15 years and maybe we need to update the picture. Maybe they had really long hair and now they've shaved it all off, or whatever the reason. If it looks drastically different and you can't tell who it is, then let us know because we probably need to update the picture. I think Olga's really good about doing that, so I don't think you'll run into that very often, but just letting you know. And I think that is it. Yeah, if you have any questions, please don't hesitate to ask me. My office number, well, I'm not going to give it on here because it's going to be on YouTube, but you can go to any of the nurses' stations and they'll tell you where my office is and they can give you my office phone number. Okay, thank you guys for your time. I appreciate it and have a great day.